As with the various types of diabetes, there are type 1 diabetes complications. Type 1 diabetes is referred to as juvenile diabetes, which is normally found in children and young adults, including but not limited to blindness, various complications involving the liver, as well as hypoglycemia and ketoacidosis, to name a few. This form of diabetes is also being diagnosed in adults as adult-onset type 1 diabetes. The primary difference between type 1 and type 2 diabetes is that type 1 is insulin dependent, whereas type 2 can be controlled by diet, exercise and possibly, if need be, a diabetic pill such as glucophage. One of the type 1 diabetes complications is hypoglycemia, which occurs when the blood sugar level drops too low, leading to confusion, dizziness, fainting, seizures, coma and even death, if not treated immediately. Normally a quick way to treat hypoglycemia is by drinking a small amount of sugar that is mixed in orange juice. Other symptoms of hypoglycemia are tremors, shakiness, restlessness in sleep, sweating, weakness, or confusion upon awakening. Other medical conditions which can cause hypoglycemia due to the way they interfere with insulin production and the metabolism of it. Other causes are due to lack of frequent meals, skipped meals and alcohol consumption. Hypoglycemia occurs in not only type 1 diabetes but in the other forms of diabetes as well. Ketoacidosis, not easily understood by the layman, but simply put, is when the body has too much glycogen, which is the sugar that is to be metabolized for energy, is too high, and the insulin levels drop. The excess sugar in the body begins to spill over in the urine, creating havoc which can quickly turn into a life-threatening situation. The causes include infections, duty, trauma, missed dosages of insulin, poor diet such as diet, starvation due to those who do not eat, as in alcoholism. The signs of ketoacidosis is not quite bad breath, but the breath has a sweet or fruity odor to it, and the same may occur with the spit as well, and are similar as those to hypoglycemia, which include dizziness, confusion, imbalance, which may make it appear the affected diabetic is under the influence of alcohol. Drug abuse will also cause ketoacidosis. There is a wealth of information surrounding diabetes. Diabetes, especially type 1, has complications which may be out of our control due to the fact that diabetes can and does affect our bodies in ways that may be out of our control. The best that diabetics can do for themselves is to follow the medication regimen, monitor their blood sugars, eat properly, know the signs of hypoglycemia, ketoacidosis, and seek medical attention immediately if adverse symptoms appear. Diabetic complications may cause not only irreversible damage, but are life-threatening as well. Learn more at diabetes-complications.org.